Hello, colleagues. I'm going to keep this video under 4 minutes, and I'm sending it to fellow orthodontists and to general dentists who participate with Invisalign treatments, and also general dentists who are just restorative and don't do any orthodontics. This is a common situation where we have a small space. This is the patient's concern. He said the space used to be closed. Now it's open. It's all he cares about. I think he said his teeth don't have to be perfect. He just doesn't like the space. Now, we want to please. It seems like an easy case, given at least the metric of a small space. But we also notice that we have no overjet. The arch form is a bit flattened. There's a deep overbite. Now, if you're going to do this case with aligners, there's a couple of approaches. You could try to do a little bit of IPR to nestle these in a little bit more to give you the clearance to retract on the upper. Or a much tougher movement for Invisalign that sometimes can get you into trouble is and program some intrusion of the lower anteriors and intrusion of the uppers so that your retraction won't lead to anterior prematurities, and you'll sort of raise these up. You can even use bite ramps or bite turbos for that. But sometimes what happens is you get not the intrusion that you wanted, and you end up with anterior prematurities. And here's where you have to take a step back. Do you think this spacing is due to tooth position or tooth shape? Does this person have teeth that are sort of flaring forward and protrusive? Well, this arch form is certainly flat and almost concave if you look at it here. And we want to make the patient happy, and we see something that looks like an easy case, but we have to say, what's the etiology of the problem? And what would be a more holistic solution for his overall oral health? He's a young guy who has some chipping. Now, if this was an 80-year-old, we wouldn't be worried. This is a 30-year-old. And so my plan here, and I feel responsible to present to him, would be to take the uppers and move them away from the lowers into a rounder, fuller arc, so that in function and parafunction, he won't have as much wear against the lowers. And his smile now is going to be fuller. It'll fill out his lips a little bit more. Light will bounce off of it. But of course, I haven't addressed his chief complaint, and that is the space. And this is where you need to explain that having something like veneers to restore the incisal edges and at the same time take care of the tapered arch form and give him close the space that way is in his best interest. I try to tell these patients I don't get a kickback if I refer out to a restorative dentist. And a lot of people will just put this on the back burner or completely dismiss it. But I want to give them this option. And if they don't do this and we try to close it like this, I'm really going to be hesitant and warn them that they are going to probably have further wear over time. So let's look at things from a tooth shape perspective and not be shy to come up with solutions that might involve some restorations at the end of the treatment, because something like this is really, I think, in his best functional interest. And, we have to explain to patients, even the orthodontist, before they get to the restorative dentist, that things like veneers nowadays can be no prep or little prep and look amazing, not chiclety, and still be safe and really almost safer for the health of his mouth than trying to squeeze this space tighter along this formation.